Secretary Kennedy, are you aware that President Trump's Department of Justice is reportedly investigating UnitedHealthcare for criminal insurance fraud in some of their for-profit health insurance plans, like Medicare Advantage?
I'm not aware of that investigation.
You are not aware that the Trump Department of Justice is investigating the largest insurance company in America that
No, I'm not aware of
for fraud in Medicare Advantage?
No, I'm not aware of that.
That you have jurisdiction over?
It doesn't surprise me.
And thank you, Secretary Kennedy, for being here today. It's actually not our first time meeting. We met a very, very long time ago when I was 9 years old in Westchester Putnam County at a Riverkeeper event. And I remember back then you talking about the importance of science and environmental action at that time. Listening to a lot of your discussion and a lot of the messages that you provide to people, you talk a lot about corporate influence and corruption in government. And this is an area that's very important to me, and it's an area that I do a lot of work in. I am, as a public servant, completely financially divested of any conflicts of interest with any healthcare companies, any stocks, any lawsuits that I would financially benefit from. Are you?
Yes.
You're completely divested?
Yes.
You have no financial interest in any lawsuit, crypto, none of that?
No. Oh, okay. Crypto? I own Bitcoin.
Okay. And do you have any other securities or assets?
I don't. I mean, I had to go through this with the Office of Government Ethics, and I had a few interests that were very minor that I divested.
Okay, just checking. I'd always like to.
No, it's a good question.
I always like to know
what
the field is before I enter conversations. So thank you for that. In the healthcare space, something that we've both spoken to is that some of the worst actors are in the for-profit medical space. Are in for-profit health insurance, big pharma, et cetera. And one of the worst companies, actually, is UnitedHealthcare in this respect. UnitedHealthcare is the largest health insurance company in the country. They are the largest employer of doctors and own thousands of pharmacies, clinics, surgery centers, and home health agencies, as well as hospice providers. Secretary Kennedy, are you aware that President Trump's Department of Justice is reportedly investigating UnitedHealthcare for criminal insurance fraud in some of their for-profit health insurance plans, like Medicare Advantage?
I'm not aware of that investigation.
You are not aware that the Trump Department of Justice is investigating the largest insurance company in America that
No, I'm not aware of
for fraud in Medicare Advantage?
No, I'm not aware of that.
That you have jurisdiction over?
It doesn't surprise me.
Okay. In your submitted testimony, you said HHS takes seriously our role as responsible stewards of taxpayer dollars. Are you aware that for-profit insurance corporations like UnitedHealthcare have been found to be defrauding public dollars of more than $80 billion a year?
I'm not aware of that number, but I'm aware that there's fraud across the for-profit sector.
Respectfully, Secretary Kennedy, if we're making decisions around waste, fraud, and abuse, this is the largest source of waste, fraud, and abuse of public dollars in the public insurance space.
Did you say $80 million?
$80 billion a year.
Did you say 80 million or 80 billion?
80 with a B. Billion.
With a B.
Yeah. If that's the case, why did you nearly double the rate that taxpayer dollars give for-profit insurance companies like United next year if you don't know those things?
Double the rate? How did I do that?
So your agency nearly doubled the taxpayer dollars that for-profit insurance corporations like United will be paid next year, meaning these companies, the largest of whom is under investigation, criminal investigation by the Trump administration, will be receiving an additional $25 billion from your agency.
How is that happening?
I would be happy to submit to the congressional record evidence of this. I will enter the CMS press release from April 7th of 2025 into the record, which states that Medicare Advantage corporations will now receive a 5.06% increase in payments next year under your jurisdiction, Mr. Secretary.
Well,
this is up from 2.2%.
I mean, we're raising
Without
was
objection.
proposed from the Biden administration. You are doubling the rate that the Biden
The gentlelady's
these
time has
criminally
expired.
investigated companies.
The gentlelady's time has
receiving.
expired.
Earlier, Secretary Kennedy, you said you wanted to instill trust using truth, evidence-based, gold standard science. But Mr. Kennedy, in late May, the so-called, quote, Presidential Commission to Make America Healthy Again released what HHS described as a, quote, groundbreaking assessment that purported to identify the key drivers behind childhood chronic disease. Improving the health of America's children is a goal I share, and I recognize this is a passion of yours, Mr. Secretary. That is why I was struck to learn that the report was riddled with mistakes, misconstruing and intentionally or not misstating key references, data, and evidence that either do not exist or are not accurately reflected in the report. When journalists reached out to many of the authors of the studies included in the MAHA assessment, numerous researchers and academics stated that they never wrote the papers as cited, or the papers cited didn't even exist altogether. Mr. Chairman, I want to submit these 3 news reports on these miscited documents from notice from May 29th and May 30th.
Without objection.
Ms. Secretary Kennedy, you're listed as the chair of the commission. Did you read the report and fact-check its sources prior to publication?
all of the factual.
Did you read the reports, and did you yourself fact-check them, sir?
I did not fact check.
You did not fact-check. So why then, as has
All of
been
the
widely reported,
foundational
excuse me, sir, I'm
assertions
speaking. Why then did the report include a citation to sources that don't even exist? How does that happen under your leadership, sir?
All of the foundational assertions in that report are accurate.
They did not
Some of them-
exist. How can they be
some-
accurate if they did not exist, sir?
Some of the citations
You know, in
were-
fact, my understanding
Some of the
is that
citations
even
were
once
messed
the
up for
report,
one day,
even once the
for one-
report was updated, more authors and researchers came forward stating that their research was misconstrued. This is quite unbelievable, sir. In fact, I was a pre-med at UCLA. They have a great pre-med program. If somebody turned this in as an undergrad to their professor at UCLA, they would have received an F, sir, an F for the misinterpretation, the falsehoods, the denials, and also citing references that don't even exist. That's lying and dishonest, sir. My concern here
The citations
my
were
concern
corrected in
here
one
is
day.
that you and this administration are undertaking vast changes to our federal public health system and using purported facts and gold standard evidence that you claim to have as justifications for your decisions, actions, and frankly, your decimation of our nation's public health infrastructure. Yet, what you are relying upon isn't real. It isn't data-driven. And it isn't based in fact, science, or reality. Sir, it's wrong. As a secretary of one of the most consequential departments within our federal government, mischaracterizing data is not just some typos in a report that gets put on a shelf. Instead, your words and your words of your department carry significant weight. Do you agree?
The
Does it carry
citations in that
significant
report
weight?
were wrong.
The
That was a mistake. They were
questions-
corrected within
and they're-
24 hours.
Yeah, but they were wrong still even after
There
that,
was
and they're wrong
there were
still today.
There were no
So do you
erroneous
believe that
factual
your
assertions,
words
Congressman.
carry significant weight?
There were no
Do
erroneous
you
factual
believe your words
assertions.
carry significant weight?
There were no
Does
erroneous factual
do you
assertions.
believe that the Secretary of the Department of Health and Human Services plays an important role in upholding scientific integrity?
Yes.
Okay, so then, in fact, what is most striking about this is that you've also threatened to bar governmental scientists and researchers from publishing in top medical journals. You've barred them from publishing in top reputable medical journals and instead proposed, quote, creating our own journals in-house. The idea that we would limit
Want me to
the
answer that
ability
question,
for federal
Congressman?
researchers to publish in the most preeminent medical journals and instead have HHS just publish more reports like their MAHA failed assessment, lacking the scientific rigor, accuracy, or peer-reviewed criteria that are required by leading journals, should worry us all for the future of medicine and innovation. Sir, you mentioned that building trust was a priority number 7. You have failed already in building that trust. How can we trust you when in your report, under your leadership, when you're the chair of this report, has false information and makes up research that didn't even exist? So, Chairman,
You left me
I
no time to
yield
answer
back
the question.
the remainder of my time.